So today we're going to be presenting the white paper we worked collaboratively on, which was concerning usability. So usability is a key concern under the new administration, under HHS Secretary Tom Price. And in terms of a definition, the National Institute of Standards and Technology defines usability as the effectiveness, efficiency, and satisfaction with which the intended users can achieve their tasks in intended context of product use. However, throughout the industry, there really lacks a consensus in terms of the scope and also how to address this issue of usability. In our presentation, we defined usability from the clinician's perspective, and we provided a kind of environmental scan of the literature currently out there, as well as recommendations as to what can be done in order to help improve usability that doesn't include legislation or regulation. So starting with our environmental scan, HHS had some resources related to usability. Usability.gov is a really generalized resource for usability that can be applied to many different industries. They also had their own set of standards, which is unique in the sense that each standard has a rating in terms of the importance of the standard for achieving usability and also the evidence backing it so that people can really understand kind of the impact and also the proof behind implementing each of these usability recommendations from HHS. The Altram Institute wrote a white paper for ARC, and that really collated consensus from different industry leaders on usability, and what they kind of came to a consensus on was the fact that a lot of the usability research out there really hasn't been well disseminated, and as a result isn't really being used to the best of its ability. NIST really started the conversation on usability back in 2010, and in this guide they provide kind of a really comprehensive guidelines as to how to achieve usability, and one of their main recommendations is to focus more so on user-centered design. The ONC Safer Guides also are a really key resource in terms of achieving usability, and those guides really provide a really great self-assessment tool that different people trying to assess the state of usability for themselves can make use of, and also a set of recommendations of what they can do going forward. HIMSS also has a handful of usability papers that came out of their usability task force. The first outlined the HIMSS usability maturity model, which similarly to the ONC Safer Guides allows people to kind of understand at what point in the evolution their EHRs are in terms of usability and what they can do going forward with that. The Tiger teams were a group of stakeholders that came together to come to a consensus and discuss all of the issues related to usability. And the AMIA wrote a board positioning paper that really set out for themselves that patient safety was a major concern when it came to usability for them.
Some of the trends that we noticed during our research and also talking to a lot of healthcare providers were that there's so much information going into EHR systems that ultimately the patient's narrative gets lost. Also that current laws make it difficult for vendors to share challenges and wins across the landscape, and that there are standards that make it difficult for developers to focus all their resources on usability. And current certification processes at an idealized modeled system and don't take into account decisions made in implementation after the user experience.
I guess it's on me then. Well, taking into account that environment, Sam, can you move over just a little bit? Thanks. Taking into account that environmental scan and those trends, we came up with 4 recommendations. The first, our key recommendations, to promote existing literature and guidelines. As you probably saw with the environmental scan, and that was even a shortened aspect, there are a lot of different recommendations of people who've written on the topic of usability. And as you can see from the trends, a lot of times they said very similar things. It's kind of like there's this cycle of people reviewing the current state of usability and recommending certain things. And that kept going on and on and on and on. They're saying a lot of the same things over and over again. So by promoting existing literature and guidelines of usability, we hope we can forward the conversation. At least people understand that, hey, this has been recommended before. Hey, we have a lot of consensus on this recommendation. We can move forward with that. But sometimes you need to be able to test the recommendations and guidelines you have, which is why our second bullet point right here in recommendation is to increase the available grants for clinician research, and that we want this to be shared across the industry. We came across a very interesting paper in our research over the use of copy and paste in electronic health records, and how physicians will often a lot of physicians, about 50%, will copy and paste information in there, which really shouldn't be going on. So something like that is a very good example of the research that currently exists. It was something that we want to be promoted, but how prevalent is that today? This was an older paper from 2014. Is that still going on? Have EHRs and the current usability of EHRs kind of stopped that? That's something we want to know, and something you need grants for to be able to research this even more and spread that research across, to test the guidelines and literature that exist right here. The third bullet point is that we want to promote a more rigorous and user-focused design testing. What this basically means is that, a lot of EHRs are tested in nice lab conditions, in real-world conditions, or whatever is determined as a real-world condition by the people who are building it, and oftentimes these aren't really the conditions that these people are going to be working in. A lot of times, the EHRs are customized quite heavily, as you know, when they go into a new hospital or a new system, and thus, a lot of times then, what's usable at a level of testing is completely unusable to the neurosurgeon who has his new, super customized EHR out there, and he doesn't know how to use it. So we want to be able to have more user-centered design testing that takes into account these changes that would be made at an individual hospital level. Now, that's sometimes very difficult. Individual hospitals do it in different manners, but even just for different kinds of practitioners, that would be very, very useful. And our fourth recommendation is to advance the industry knowledge of these practices by training health IT professionals to apply these principles during implementation. We had in a lot of our interviews, this sentiment was echoed quite a bit. Hospitals don't have the resources to be able to implement proper usability measures. They don't know how to do it. They could use someone who has the training to be able to implement this stuff. Usability trained persons or health IT trained professionals would really be an aid to these people in hospitals. Could you take the next slide, please? In conclusion, any of these recommendations, if acted alone, would help. Altogether, though, these would help quite a bit. They're not going to substitute for legislation and regulation. That does have huge, major power to really shift the conversation focus, but these can really provide a good first stepping point in starting a new conversation about usability and helping the conversation that kind of exists today move forward. We can finally get out of that cycle of review and recommend, so that maybe we can come up with some new and more developed ideas on the practice. All right, that's the paper. I think we can take any questions on it now anybody has.
A couple of questions. First of all, well done. This is exactly what I was hoping for when I asked the group to get the environmental scan and identify some recommendations. With respect to the recommendations, are you foreseeing, where do you think the money will come from? Could we just go back to the recommendations? So with respect to the second bullet, what's your sense of available grants? Is that government funding, non-government funding?
It was mainly government funding, though obviously non-government funding would be provided. We kind of increase available grants. What we kind of thought in this respect is if, say, NIH or ARC has a grant that hasn't been really used or applied for as much as other ones, that they could perhaps open up certain grants to be able to be used for usability testing, maybe open up specifications. I know it's kind of hard, especially currently, to get a lot of new funding, though NIH, I believe, is getting more funding, so they might be able to, but ARC have those problems. So we kind of thought, maybe they could open up existing grants to be able to be tested for usability, that the money's already there, but just now that it can be used for usability.
So if you'll modify that bullet point to make that point of opening up, that's a great recommendation, and then you take it to a completely new level by making that additional recommendation. So that's fantastic. My second question is, who were some of the people that you interviewed? Whether provider types or individual names, whichever it would be.
Yesterday we had an interview with Dr. Lin, who works at Nationwide Children's Hospital. So he gave like a doctor perspective. That was good.
Okay.
A lot of them kind of echoed the same thing. So after quite a few calls, it was all kind of reiteration of the last person we had spoken to. But
So so in terms of building on this presentation, then list that, list who you interviewed as well, because that adds some credibility, because you did interact with some well-known individuals in the industry on this issue.
And in the paper, we have a little bit in terms of the environmental scan, talking about the different clinicians we spoke to
Okay,
and some of the general themes we got from that as well. So
fantastic.
that's something in the paper, you can take a look at that.
And then I just lost my third question. So are there others that, Morgan?
So did anybody say that we should have regulations in this area that promote better usability?
That opinion was mixed. There were some people who said, we could use guidelines, we could use government-backed guidelines. But then there were other persons who said, the government getting involved in this can create a lot of problems, it can create overregulation, they create one regulation, everybody's trying to meet the minimum standards set by that regulation, and they don't necessarily focus on the other aspects of usability that they would traditionally in a private sector space. So it was a mixed opinion.
Yeah, and I think also because our ask was specifically about what can be done without
Right.
regulation and legislation, we kind of structured our calls in that way.
Right.
So they tended to stray away from advising on that since it wasn't particularly relevant.
Yeah,
in this
and I mean,
case.
that's a much broader question, just about, yeah, I think the recommendations are great, and the research